Hello, you're welcome back to my channel. So in this video, we're going to discuss about what you expect when you go for sexually transmitted infection test. It depends on where you go, but either if you go to laboratories or you go to hospital, all what you expect are the same. The difference is that you may be required to see a medical doctor to ask you some questions regarding your signs and symptoms before he or she will outline which of these tests that you are to carry out. However, these are basic things you will expect when you go for sexually transmitted infection test. Which kind of test is recommended for sexually transmitted infections? If you suspect, maybe for example now, you don't actually know what you want, but it's just that you want to do sexually transmitted infection test. Maybe you have a sexual contact with somebody you don't trust. So they might require some of these tests for you. Number one, MCS, which stands for microscopic cultures and sensitivity. Number two, HIV. In medical laboratory, it's called RVS, which is retrovirus or human immunodeficiency virus. Hepatitis B, HBsAg, hepatitis B surface antigens. I have VDRL, Venereal Diagnostic Research Laboratory. This is to investigate for syphilis. So these are common tests that they may expect you to do. These tests, for example now, if you are requested to do HVS, which is high vaginal swab, MCS, the laboratory scientists will collect sample from you, and the sample is taken from your vagina as a female. If as a man, the sample is taken from your urethra via urethra, that is where the piece comes out from your penis. That's where they will use what we call swab stick. The swab stick, which you see on the screen here, they use what we call swab stick to collect either from the urethra or high vaginal swab from the patient, the female patients. Now, why is it necessary that the medical personnel should collect the sample? It's because, like I said earlier, microorganisms are ubiquitous in nature. So improper collections of this sample might introduce infection. So sometimes you go for infections because improper collection of this sample, then they will give you a separate result. That is not as if the scientist don't know what he's doing. He know what he's doing, he or she know what he's doing. But it's just that what you provided to the scientist is what they give you back. So when you provide maybe that swab stick, now use them to touch the tips, or the swab stick touch outside part of your body, or the sample is not properly collected, sometimes you might have the infection, you may show that nothing is there. Sometimes you might not have the infection and it show that something is there. It depends on how this sample is collected. So that is why it is necessary, it's compulsory that the health personnel, the medical laboratory scientists should collect the sample from the patient because they are well trained for it. They know the procedure and what to do to collect the sample. In terms of other investigation like HIV, hepatitis B, VDRL, the blood sample is collected. It's a blood sample that you will use for the investigation. And this one, the result come out immediately. But in case of that high vaginal swab and urethral swab, the sample will take up, the result will take up to 3 days. It's almost 48 hours because this is how it's done. Maybe 24 hours is for first incubation, then it will insert sensitivity. Then the next 24 hours, the result will come outside. So that is why you often get your result 48 hours after the collections of your sample. This is how it's done. You do it for inoculation and leave to watch if there is growth of any colony within 24 hours. Then after 24 hours, they will insert what we call sensitivity discs to work to see the next 24 hours to see which of these drugs that will work for it. The importance of sensitivity is to check which of these drugs your system goes with it, which of this one your system will resist, which of these your virus, the infections in your system will be resisted to. So that is the importance of this sensitivity. However, this collection of the sample sometimes might be uncomfortable for some people, but some people don't mind. In whatever case it may be, feel free. There is no any pains. You won't feel any pains except maybe if you are taking your blood sample, and the professionals will not. You won't feel just a little slight pains. They're just like ants, stinch. So you're not going to feel any pains when they are collecting a sample. So when the result comes outside, when the result come out after 48 hours, you can decide to see if they have a medical doctor there, which you will see to explain the result for you, or head scientist there can explain what is in the result for you. You are to decide where, if it is hospital, you can just decide to take treatment there if there's an infection. But if you choose to take it outside, a standard medical laboratory result should be able to be understood by all medical doctors across the globe. So wherever you take that result to, all medical doctors across the globe will understand what is in that result, if the result is properly written according to the guidelines. So that is it. But there are some infections, sexually transmitted infections that are untreatable. Like I mentioned in one of my previous video, HIV, human papilloma virus, and hepatitis B, hepatitis C, they are not treatable. Some of those infections goes on their own. So maybe if you are diagnosed to have those one or two of those infections, which are viral infections, they may decide to go on their own, but they are not treatable. The treatable ones are the one caused by bacteria. So these are some of the things you need to know when you are going for sexually transmitted infection. However, the best way of preventing sexually transmitted infection is to abstain from sex or abstain from unprotected sexual intercourse. If you are going to do it, make sure that you use condom. However, condom is not 100% safe. You have 50-50. So abstinence is the best. And having sex with someone which you are sure you trust, one partner is the best. So thank you for watching and see you in my next video. Bye for now.